Sir, what are beta-lactam antibiotics?
Okay, beta-lactam antibiotics are those antibiotics which have a beta-lactam ring structure. They are actually cell wall synthesis inhibitors.
What's the classification of beta-lactam antibiotics?
Classification. Okay, look, there are a lot of drugs in beta-lactam antibiotics. First drug group is the penicillins, the cephalosporins, and miscellaneous drugs which are not under penicillins or cephalosporins. They include the carbapenems, which are imipenem, meropenem, ertapenem, as well as the monobactam, which is aztreonam.
And sir, then what's the mechanism of penicillin?
Mechanism of action of penicillins. Look, penicillins act in a way, first of all, they bind to the penicillin binding protein on the bacterial cell wall. Then they inhibit the transpeptidation. And last of all, they cause autolysis of the bacterial cell wall.
Okay, sir, then what's the classification of penicillins?
Penicillins are divided according to their spectrum of action. First is the wider spectrum, which include ampicillin and amoxicillin. They are actually active against gram-positive foci, negative foci, and positive rods, as well as pyrosheets. While piperacillin and ticaracillin, they act against, the negative rods, including the Pseudomonas, Klebsiella. Okay, and then there is the narrow spectrum, penicillin G and penicillin V, Streptococcus, meningococcus, as well as positive bacilli, as well as pyrosheets also. And then comes the narrower spectrum, which are methicillin, naficillin, and oxacillin. They are actually used against multi-drug resistant Staph aureus strains.
Okay, so then what's the mechanism of resistance of penicillin?
Okay, look, the gram-positive cocci, specifically also the negative rods, they have an enzyme which is known as beta-lactamase enzyme. Or it is also known as penicillinase. It destroys the beta-lactam ring structure of the antibiotic and resistance develops. For an example, more than 90% of Staph aureus are beta-lactamase positive.
Then how do we cope with this resistance?
Okay, then we can add a drug in association with the penicillins. They are known as beta-lactamase inhibitors, clavulanic acid, sulbactam, and tazobactam.
Thank you, sir.
You're welcome.